This podcast is brought to you by the School of Advanced Study, University of London.
Good afternoon, everyone. For those of you here in the room and for those of you following on live online, welcome to this afternoon's IHR Digital History Seminar. I'm very pleased to welcome Professor Sophia Ananiadou from the University of Manchester, who's going to be talking to us this afternoon about text mining and the history of medicine. Just a few words before I say a few things about Sophia. Just generally speaking, first of all, we are screening this live, so we are recording this. It will go up on YouTube afterwards. So when it comes to the questions after Sophia's talk, just be aware of that and what questions you're asking. The second thing, if you are following us live online, please feel free to tweet in any questions you'd like, and we'll pass those over. And do feel free to tweet under the hashtag DHist, and that everyone will follow on that. Sophia's going to talk to us this afternoon about text mining, the history of medicine, which is a project under the AHRC Big Data Project, looking at text mining, the British Medical Journal and Medical Health Officer of Health reports. Sophia runs the National Centre for Text Mining, NaCTeM, at the University of Manchester, which has now been in existence for over 10 years. She's a professor in computing science at the University of Manchester with undergraduate and PhD in linguistics from Paris and from UMIST. She's jointly authored over 100 articles. NaCTeM is the first publicly funded text mining centre in the world, and it is one of the key areas for research and the application of text mining. So I'll pass over to you now.
Thank you very much for inviting me. I'm delighted to give a talk on some wonderful premises as well. So I realize that some of you, well, perhaps half of you don't know anything about text mining, but some do. So I'll try to give you some gentle introduction of what's text mining. At the same time, for the technical ones, I will have enough technical features so to keep you excited. And then I'll conclude my talk by showing actually, not live, but I will show a demo of a prototype system we have created for this archives. So the outline is basically, as I said, what is text mining, very briefly, what's the whole process, what we had to do in order to text mine the medical historical archives. And by this is basically enriching the documents with semantic annotations. And if you just look at the text as raw text, semantic annotations are finding types like entities and events, which I will explain soon. Perhaps an important part, depending if you have historical data, is how clean this data. So OCR correction was one of the parts of these you had to do. I'll go a bit quickly on that because maybe it's too technical. But I think what is important, and I will spend some more time, is explaining how we created automatically a term inventory. We call it a time-sensitive term inventory for the historical archives. And by that is if you have to create a search system, it's very important to expand your query. If you don't know how people talked about tuberculosis in the past, you won't be able to system to suggest those terms. And I'll conclude by showing you the prototype search system. So this is actually this is the slide where it tells you what it's all about, but a bit simplified. So the whole idea is you start with unstructured text, all data. You have a sentence there. I cannot point, of course. You have a sentence which is from any archive. And this is unstructured. So there is text mining, in essence, creates, you put a pipeline of tools, of technical tools, text mining tools, which typically they have to tokenize the text, you have to annotate it with syntactic structures, and also semantics. So this kind of processes, which I said is simplified here, typically withdrawing from existing dictionaries or ontologies as well to learn the semantics. and then the unstructured text becomes structured. So you have annotations, you find the syntax and the semantics. The whole process, of course, happens automatically. There's nobody's doing it manually. But you need to put the pipeline together, you need to have the infrastructure together and develop tools to do that. So it's a kind of a pipeline, different tools put together using different infrastructures to basically take completely raw text and render it into a structured text. So text mining takes unstructured data and makes them structured. And based on the structured data, then you can create search systems, you can find associations, whatever else you like. So, and you can see here some of the sentence, which you cannot see very well, is I believe the pain was seated in the pillars of the diaphragm. So you see here, I'm going to change actually the display here. Ah, it's better. So you find here under pain, it says it's a sign or a symptom. This is automatically a sign. You find here occasion, this talks about the causality or other anatomical entities and sign and symptom. So this sentence actually is a good exemplar of what text mining does. So semantic type is that, automatically assign semantic type to a word. Okay. So the impact of text mining is, as you've seen before, first of all by extracting automatically concepts or what we call name entities like a symptom, a treatment, and for instance causality. All that is basically can be used to mark up the text. And if you want to create a search system, supports semantic search, but supports also improves what we call information access. So if you have too many documents, it's very difficult to understand and find out what they're talking about. So you need to have this type of tools which are actually do the semantic analysis. But also, as you noticed before, you don't only mark up entities and concepts, you also extract relationships between those entities. So this automatic assignment of relationships, causality or interaction or whatever, or effect, as we have done here, allows you to do a bit more deeper semantic search. So you might want to find out what causes tuberculosis in your historical archives. So the system automatically extracts this type of information from text. And you can do even more. You can also extract negated statements or opinions or hypotheses, or even gathering these contradictions from text. So all this, it's important to note that all this markup and annotation is automatic. And once you enrich text content in this way, then you can do all sorts of things, from search to question answering, to sentiment analysis, to trend analysis, and so on. So it's a kind of supporting researchers, in this case historians of medicine, to do their work. So a bit about our collaboration. We worked with the Centre for the History of Science and Technology in Medicine at the University of Manchester. They're really historians of medicine, so they had specific needs of how they wanted to use those archives, and we are of course agnostic of their needs, but we're providing the tools. And NaCTeM is, as you heard before, we've been more than 10 years in existence. The centre has been funded by JISC, EPSRC and BBSRC. We provided text mining tools, services and resources for a variety of users. This specific project has been funded by HRC. So what was our aim? First of all, we had to mine the data. And there are two types of data we mined. The British Medical Journal, the whole collection, it's about 358,000 articles from 1840 till now, and the London Medical Officer of Health Reports from 1848 to 1972. So the idea for our users was to look at different perspectives. In this case, we look mostly at lung disease, But what text mining can do is provide different facets of information. You can look at an archive from a medical perspective, or public health, or civic, or a civilian, or a clinical perspective of how you can treat and prevent diseases. And the interesting thing, of course, is you need to do this over time, because you have to classify the data into different decades according to how historically this was important, and this will rely on our collaborators. And this is where text mining comes. We use the different tools, resources as well, and infrastructure. So the aim was search, as I said, and one of the first issues when you have to text mine text is how clean or how amenable this text is for text mining. So if you have errors which are inserted due to digitization and OCR, then the text mining tools, they will propagate errors. So you need to be able to clean up the material. So in this case, some archives, this depends of course when the archives have been digitized. In some cases the MOH have been OCR'd recently, so they were in a good quality. But the PMJ archive, which was digitized a few years ago, we had to do some error correction and cleaning up. And again, re-OCRing in most cases is quite difficult. It's time consuming, not difficult, it's time consuming and costly. So the solutions for that, basically the whole project did the following. So we had to definitely apply, although initially we didn't anticipate that, OCR improvement techniques using text mining. Then we had to automatically add the semantics, the semantic information. And I will explain that. So we had to use what we call the semantic entities, and in this case, the conditions, signs, symptoms, or therapeutic measures, diseases, and so on, which are very much specified by the users. And I have to say that these entities and the events are really customizable. So once you know, different users have different needs. So they're not necessarily set in stone. You can develop new entities and you can develop new types of events. But in this case, our users were very much historians of medicine, lung diseases, and we produced a system who has a big focus around this area. For search, again, it's very important to look at the terminological variation, how terms change over time, as I said. So we had to create automatically a term inventory to allow us to support our search. So the semantic search system, which I will show you how the prototype looks like, has different parts. The first part is to allow the user to automatically build a query. As you can start from a very simple search, but then the system guides you, suggests questions and basically items to be added to your query. And one of the parts is also historical variants, which perhaps are not known to the user. So if you have a student in the history of medicine, perhaps the student doesn't know how, and if you put a query, normally you retrieve documents, you know consumption, but you don't perhaps know what this is. So you might be able to find in existing dictionaries, but maybe not. So you need to be able to find automatically related terms. And then there are two types of faceted search. One is already exists because the articles have what's called metadata. The metadata are authors, titles, and dates. So you can still use that for your search. But the interesting part for us is adding another faceted search, which is based on the semantic content. And this is really the entities and the relationships, which I will explain now. So now there are different ways of doing that, and some people automatically, so this is an automatic method, but we're using what we call a supervised method in our field. The supervised is we still need to have a small gold standard. So But you can do this in a supervised way, but in this case we had very limited time, so we wanted to have good quality as well, and we chose to have create a corpus, a gold standard. This is, a gold standard is a subset of documents which has been selected by our historians, and they manually annotated, so we had 2-3 people manually annotating a small subset. This was 25 articles from B&J and 4 extracts from MOH. So overall was 70,000 words, but the interesting thing is they're also classified into decades. So the different decades were interesting because different events were happening, like 80s, 50s, 90s, 20s and 60s. That's how we capture the terminological change in the medical history. So very quickly for the OCR post-correction, what we did, we took the OCR, which had errors, and then we corrected it afterwards. Because as I said, re-OCRing is very time-consuming. Our project also lasted 15 months. So there are different spelling checkers around, and we chose the open source spelling checker, the Handspell, which, as perhaps you know, it's very really for human use. So Handspell produces a ranked list of spelling corrections, but as I said, it's tailored for human people and for general language. It's not for history of medicine. So what we did to support that, we augmented the Handspell dictionary with the Open Med dictionary, which is for medical. And then, as I said, we did override some of the default spelling by looking at suggestions based on a corpus frequency of certain words. And we used also word frequencies based on different decades. So basically, augmenting, using frequency lists from different decades and adding another more medical dictionary, we corrected the approach. So this is to give you a sample of the corrections. So this is an example from 1840. The ones which are in red are actually, in red, the errors, okay. Errors is exactly how BMJ looked like, so we had to deal with the text. So if you don't correct that, then you apply text mining tools, they will not understand that this is a word, basically. So here is basically the correct changes made by Handspell, and this is incorrect changes, and those are still OCR errors not detected by Handspell. And by using the frequency-driven Handspell, you have corrections only obtained using the frequency list, as I said, from different decades. And this is basically corrections which are started by using both original and frequency-driven methods, and still some errors. Without actually taking too much details into the OCR, it's just an important step if you're working in medical and in historical archives. It depends very much on the quality of your corpus. So sometimes if you use, one of the issues is you don't want to have overcorrection. So here is the original text, and then you have what you have the red from the basic Handspell, you have lots of basically overcorrection. By using the frequency-driven, you have some corrected, but basically if you add the Open Med spell and the frequency-driven Handspell, you have basically, you match basically what is supposed to be the original text. So this is basically what you want to have. And I'll skip that because it's an evaluation. Now, as I said, this was a necessary step we had to do to obtain a clean material. The next step is, as I said, to do the gold standard, which I had before. So then we had to create, with our colleagues from Manchester, the corpus. The corpus is the gold standard. And here you see there is a whole, of course, reasoning why they selected those, so they're working on lung diseases. So they selected the semantic type of anatomical entity. It says it's an entity forming part of the human body. And the examples are lung, lobe, sputum, and fibroid. Biological entities, and as you see the biological entities, the semantic type, which has different words, like guinea pig, flea, tubercle, bacilli, and so on, conditions, a medical condition or ailment, the environment, that has been also a very important area for lung disease. What are the factors which are important to prevent or to have a condition? And here you see humidity, milk, linen drains. So these are actually, they have sign and symptom. The sign and symptom: cough, pain, rising temperature, swollen. Subject, if the patients, the people who are actually negatively anxious, people who have negative reactions to tuberculin, and therapeutic or investigation types. So treatment substance or medium procedure, which is an investigation. So this is the entity. So now you see that on the basis of this kind of annotation, your search is basically, you're doing a search based on semantic types. So you don't just look at a fibroid or lung, but you're looking at anatomical entities. You're searching on conditions in general. So you make your search a bit wider. What are the conditions? What's the environment? And then, as you'll see in the results of the search, the environment is quite broad. So you have an understanding of different words basically existing in the environment. Okay. So the next part was a bit more difficult because we had to produce, to find, when I talk about events, it's kind of complex interactions linking those entities. And I'll give you some examples here. So we chose, actually our colleagues chose two types of events. Affect, and affect is, I'll give you an example here, lots of examples. Affect is an entity or event, could be affected or infected or changed or transformed by another entity or an event. And you have things like the fluid diffusion is limited by adhesions. So you see the verb is limited, but the event is affect. And you have something in your participants, the causality, the cause of the affection is by adhesions. And you have a target, the entity, or the event which is affected, the fluid diffusion. So,
Sophia, could you go back to full screen just for this bit, because it's hard to follow.
Oh, I thought actually, sorry about that, I thought I had full screen. I was looking full screen, but you didn't. Aha! So, okay, so I thought you were looking at full screen too, but I was,
Thanks.
how can we make it so I like to see full screen without the notes, but both of us.
Oh, I see. I don't know.
Because I want to see the full screen too.
I'm not quite sure.
Otherwise I cannot see. So apologies. I had the impression you were looking at full screen. So right. Hopefully I'll see it now. Another example is, okay, it's good. So it's like the patient did well with only a few doses of ammonia. So again, you have like did well, affect. The subject is the patient, and then cause is the cause of the affection, and you have the therapeutic or investigation. So the entities, the interaction between the entities, how, what cause, basically what affects what, or what transforms another entity. So you have the participants is cause, target, and subject, and the type is affect. How we will use that, you will see it soon. So you can basically ask questions. What affects? What what actually transforms? So it's more general questions, and then you see all the verbs which are being realized here. The other type of event we actually dealt with was causality, and again, causality is very important because in causality you have an entity or an event which results in the manifestation of an other entity or event. So here are the different examples. I believe the pain was seated in the pillars of the diaphragm as it was chiefly occasioned by hiccup. So the causality is here occasioned, and then you have a cause. The cause of the event is the sign of the symptom, hiccup, and then you have the result, the resulting entity, so was the pain, another sign or symptom. And then you have different anatomical entities annotated, pillars of the diaphragm. Another one is the vast majority of cases of phthisis and are of tuberculous origin. So the origin is the causality, then you have a cause of the event, which is a condition, tuberculosis. Another condition is the result, thesis, and the subject case. So as you can see now, the whole text, all this collection is transformed with semantic annotations of entities and events. So your search now, you can search into questions what affects condition, it's a different, it's not keyword search anymore. If you remember in the beginning of my slides, and said, just doing a keyword search, we all know that you have too many results, which are not really pertinent. So now a bit more, a bit slightly technical, which might perhaps skip bit. So basically, all those things, how do we produce those systems? How do we create those systems? So we develop with word classifiers to extract those entities automatically. So once you have the gold standard, and you know what you want to do, then we use machine learning based methods to actually develop new classifiers and extract those entities automatically. We train them on the gold standard, and then we're using also dictionaries to obtain more specific information. In this case, we use the UMLS metathesaurus and the metamap. The metamap is a name entity system for the UMLS concepts, which we use. And then also we used also different types of standard training, with basically taking into account different morphological and syntactic features of the entities and their context. So the next part we did also is to show how we could map the concepts from our corpus into UMLS. So how those categories which are obtained for UMLS lookup or metamap were mapped to the categories of our corpus, and we can see them there. So there were different, from the specific entities that I mentioned before in the corpus. Overall, the performance, basically a baseline system produces a good performance. 80% is like F-score, it's the average between precision and recall. Some entities, they were a bit difficult. Actually, some of them, they're not so very difficult even for the annotators to agree. So typically, to produce an annotated corpus, we have 2 or 3 people marking textual parts. So we need to have what we call an agreement between. If it's too much of a disagreement, obviously our annotation guidelines are not so good. So we had some good agreement, but certain entities like environmental or therapeutic or investigation, basically the recall is rather lower than the precision. But we know how to improve it, basically. We know what to do to improve the performance using more semantic information. And I said, what is recognized is actually accurate, that's important. However, some entities may be missed. We found that by using the UMLS overall was a good thing. It takes advantage of the fact that we can plug into our name entity recognizer, which has a facility to just hook into dictionaries and improve the performance. So the next part is basically now we start doing more interesting things and putting events, as I said, the causality and the effect. And I explained that before, so you've seen that you find the participants of an event. An event is like causality, you have in the sentence origin. So you have the subject, the result, and the cause. For this, we have already tools in-house, which actually automatically extract events from different types of text, from not only this collection, but from biology, from medicine, from news, so it can be adapted to different domains. And so we're building on existing tools, but we basically had to train it, customize it for the specific archives. So the task is, again, as the summary, it is a complex task overall. So we had marked up about 600 affect and 200 causality events. And very often is, one of the difficulties was that the different types of triggers in an event, which could be challenging. Although we actually it's a very good result for the amount of time we had, but we still carry on the work. Although the project is finishing officially in 10 days' time, we are planning to expand on the corpus to just cater for more events basically on this specific user case. So now I'm just going to make a small, a tiny sort of diversion to tell you about, and I want to talk about how we can interpret the events. So interpretation is to say if something is negated or if it's, for instance, certain or uncertain. So once you identify events, something like causality or inhibition or whatever in a text, then you want to take the sentence and say they're not all the same. They might have a completely different perspective. So I'll show you something we have done for EuroPubMed Central, which is actually funded by Wellcome, and we call it the Evidence Finder. And this is actually massive because it works on about 2.5 million full papers. But I'll just show you how it's a different system. I just wanted to talk about the interpretation to understand how it works. Here is the user query. It's a different, as I said, a different system. It's for biomedical text. So if a user asks a query, basically Alzheimer's disease, the system automatically extracts, suggests questions. It's not like autocomplete, like Google says. Basically, we have parsed the text, we've annotated the text, and then we know that if I say Alzheimer's disease, the specific types of interactions and associations which would be of relevance. So we generate questions. And here you would have extracts, snippets from the whole documents, which are automatically recommended to the user. So if you, for instance, you look at the questions, if the question is of interest, you look at the answers. So if you go through massive 2.5 million sort of types of data, it's a more efficient way of understanding what you're looking for. But the reason I'm diverting to that is because I want to show you something else. And this is the interpretation of events. So what we call is a discourse context or the meta-knowledge. If you look at the sentence like P21 RA proteins are not activated by IL-2, or our results suggest that P21 proteins are strongly activated, and then you say show that are weakly activated. Now, those are the same, this is in text, those are in text in Medline, PubMed. So there's the same sentences with the same, basically the same entities, but they're interpreted in a completely different way. So what we trying to find out for, and this is an important part actually, what we're trying to figure out is, are they strongly, are they weakly activated? Do you actually suggest, because you have a speculation here, you're not so certain, or is it an observation? Is it a negation? So we did that for EuroPubMed Central, and as you can see here, you can actually, once you have a question generated automatically, you can choose if you want to find sentences which are negated or certain or uncertain. So it's a different way of classification, of automatic classification of sentences. So you have to look at this as a search system which allows you to look at different types of interpretations. Okay. Now we didn't have the time to do that for this project, but we're going to do it anyway. So after the project finishes, we're going to add this kind of discourse. So we plan to enrich the collections in this way. So now I'm going to before I go to the demo, to the last part of my talk, which is the terminological inventory. And as I said in the beginning, the concepts, especially in historical data, they can be expressed in various, they change over time, we all know that. They also have a semantic shift, they might mean something completely different. They sometimes are obsolete, they're not used anymore. But nevertheless, if you have a search system in a historical archive, you need to be able to capture all that. These are some examples. So to address, oops. Oh. This is not what we want to see.
There we are.
Good. So, in order to address this issue, we built what we call a time-sensitive terminological resource automatically. And the question might, somebody might ask, why not using existing resources? And the obvious thing is that the existing resources, they might not contain historically relevant terms, and often the resources, if they're not built automatically and constantly updated, the moment they're constructed, they're not pertinent anymore. So you need to take into account that very often some of the resources of mesh are more contemporary, they're not historical, or they might not be updated, and very often historically relevant terms, they're not represented in a consistent way. So for this one, just to give you an example, the term variation of TMJ between phthisis and tuberculosis, you can see the patterns of usage and of tuberculosis in one of its well-known historical, basically relevant synonyms, which is phthisis. And tuberculosis was basically little used until after the latter part of the 19th century, but phthisis was much more popular until the end of the 19th century. So this is something we have in the system automatically. You can capture the changes. And another example is scarlet fever and scarlatina. Again, you have different types of usage patterns for both terms. So basically, the point here is that if one fails to take scarlatina into account as a synonym of scarlet fever, you pick up half of the documents out. You will not be able to retrieve the documents which are relevant to your query during this, this period. So what we did for that, we constructed, as I said, the time-sensitive medical inventory from not only from BMJ but also from the MOH archives. So it's basically, we used also historical lexica to do that. So we complemented our work with existing historical data, dictionaries, and then we extracted term variants from this 19th century lexica, and then we looked at the corpus as well to find other term variants doing an analysis which we call distributional semantics, but perhaps this is not so important here. So this is the historical lexical we use. One is the nomenclature of diseases and the index of diseases and the symptoms. So it's about 1872 and 1882. So each, for instance, of these resources also had was accompanied by OCR text, and this is how basically it looks like. You have a synonym set which contains several variants of each disease concept, and ranges from the English main term to the Latin term to synonyms and different subtypes for English and Latin terms. So what we did then is basically, it's important to have, as I said in the beginning of my talk, we always use ontologies and dictionaries because we learn from them. But then the important part is you have, automatically you're creating classifiers, you learn from the dictionaries, and then you're applying to the full corpus. So we process basically then, we linked the different synonyms to UMLS using different methods, which perhaps I should skip. And as I said before, the if you look only at manually curated dictionaries, you will not be able to understand, to cover the real usage of variability in medical texts. So to do that, we pre-processed, so just to give you a bit more technical background on that, we have to pre-process the variants. We use different methods we call distributional similarity to detect these technical terms. So maybe that's a bit, so here if you see the panel here is a pipeline. Do you remember in the beginning I was talking about text mining, text unstructured text, makes it structured, but use a pipeline of methods. And this is an example of a pipeline. So the pipeline has a reader. A reader is basically how we're reading of a BMJ, how we're taking the whole archive and we're about to analyze it. Then we have different sentence splitters, taggers. It doesn't matter. It's basically a component, a set of text mining components. Now the reason you see it in this type of panel as a pipeline is because we have developed an infrastructure to do that. So rather than thinking about or make our life difficult, our infrastructure allows us to take those tools, and if you see them as Lego components, we put them together and create a workflow, and that's a workflow using our infrastructure to do, for instance, search or to identify entities. In this case, our workflow identifies named entities and NER suite. And you can use dictionaries, you can add dictionaries as well, you can use different machine learners and so on. So we combine two recognizers. So we combined all those dictionaries historical. We always use existing dictionaries for our work because it's very valuable information. And then the machine learning part. So now I want to explain very briefly that how we were able to say that, to identify that scarlet fever and scarlatina are basically closely associated automatically. So we used what we call distributional similarity, and the whole idea of that is you're looking at a word like scarlet fever, but scarlet fever has a context. It occurs with other words. I mean, all the words, they're not hanging around on their own. They're having friends. Actually, Firth said you should know a word by the company it keeps. And that's very important because in different domains, subdomains, words co-occur with other words. That's old news. But this is very, very important because then by looking at the context, the contextual information of scarlet fever and scarlatina, we find that they have similarities, so we compare them. So because they have all these different, similar, they occur in similar, they hang around with the same friends, I would say, word friends. I don't know if it's a good thing or not, but that's how we basically, very simply, we do that type of thing. So here you see that scarlet fever, scarlatina is very highly ranked basically with scarlet fever, and you have other words as well. So doing that, I know it's a bit technical, is I want to show you how all these components are put together. We can now make suggestions of what is a related term through the historical archives. It's basically not so difficult because you really have to look at words occurring with each other and distributional similarity measures and cognitive similarities. They've been around for many years, nothing new. But it's how you put them together to actually do that. So now I'm going to show you the system, and I'll finish my talk. So this is the demo we have developed. So it's basically you start with a query, that's the query builder. So to start, then you start refining it. So initially you have all the documents, and once you just you say, okay, I want to start a query. You have I don't know if you see here. Oh yeah, that's the query builder. So you say, okay, the next part is you can choose from a term, from an entity, an event. Those are the semantic metadata we have automatically derived from these archives to allow you to do search. But at the same time, you have the other metadata that are in the documents, the publication date and the authors and titles and so on. So first query, the user can define the search basically as using different criteria. And here I start asking, I can ask a specific term. And my term, and it was an example here, is pulmonary consumption. So you have pulmonary consumption, and then you say, okay, I'd like to define further the query. So if you next step, you have now automatically, you see the terminological variability, basically it shows you how the word what was the question I asked? I don't remember. The pulmonary consumption can basically can occur throughout time. So, but what you also have here, you can see that you have different other related terms to this specific initial query. So the system recommends related terms. And in this case, I might, for instance, choose, and you see, you can see also the frequency, something which is related. So now you're adding another term which is related to your query. And in this case, you have related to thesis. I've changed to pulmonary tuberculosis. And now you see you have two types of terms. Pulmonary tuberculosis is also added to the query builder, like the pulmonary consumption. And at the same time, you see that in your panel, you see how those terms are occurring through time. Okay. So by clicking basically, as you see on the term, the related terms box, you can see the term can be added to the query, and the documents also and the related terms are updated as well, because in this case you added another, so you have a different view. So you have more documents or less documents according to your query. So this is basically the components, the composite time graph is automatically updated, terms related to pulmonary consumption and pulmonary tuberculosis. And then you can actually do another, refine your search, and look at other metadata, refine the documents by the date published. So in this case, we want to find documents till, say, 1950, so only the documents published up to 1950, and you have much less documents than the whole collection. But you also might refine them further, basically the documents, by looking at other types of semantic analysis. So here we want to look at entities. And you have, as you remember, we focused on anatomical entities, biological entities, environment, sign, symptom, subject, and therapeutic or investigation. So now I can semantically refine the documents according to the types that I'm interested. Say, for instance, I want to go into environment, and if I click into environment, automatically the system suggests all the words which are under environment. So now you can click at the ones which are suggested, because the system, we know they exist. And you have, for instance, you can click, I don't know, milk or something, or country or town. And then you now, every time you are searching, you are looking, picking up an entity or an event, you have less documents, but they're refined because interactively you choose the types of semantic entities or related terms, or basically publication year. So here you have, as you see on the query builder, you have two terms, pulmonary consumption and pulmonary tuberculosis. You're looking up to 1950, and you're also looking out of this document collection at the name entity, environment, and out of this you've selected milk. So really for a historian who wants to find a different environmental conditions in specific time for tuberculosis, you can really narrow down your search as you wish. Maybe you care about how milk was used. I mean, there are different types of searches that a historian can do depending on the requirements. So you are really narrow down, you restrict now your query filter. And then you see you have, of course, less documents, but these are reduced because they're more pertinent. You narrow down your search. And last, the next query is events. And in this case, you can still keep you can actually, if you want, you can remove some of the query filter of the entities or some of your questions, or you can add. And in this case, we have we put something on causality or effect. I don't know which one I have here. So in this case, we have only two basically events. And if I put causality, then I said in tuberculosis. So you're interested about events that cause tuberculosis. So this is a type of question, a general question you can ask. And in this case, the user basically partially, you don't have to complete, partially completes the template according to the type you're interested in. So you want to know, to search for documents mentioning the cause of tuberculosis in the archives. So once you do that, you're ready to, you have the documents back, which are annotated, and this is how the document is displayed. So you have here the first part, the bibliographic information, then you have the document content, then you have the semantic information. So all this automatically identified per document. So the semantic information here, as you see, it's also expressed as a pie chart, and all the entities, they're highlighted in different colors. So you know if the document has, the distribution as well is there, so you see if environment is more important or treatment is more important. Then you start looking again, searching the text. So in this case, I don't see it at all. It's an environment, so you look at the different number of environmental entities in the document. But also, interestingly, if you look at these semantic entities and events, it's like a semantic fingerprint of a document. So if you're a historian, you're looking, you look at the types of entities co-occurring. So if you're looking at milk, each document has specific types and instances associated. So you're characterizing semantically the whole document. It gives you ideas about people in the 1950s who talk about that. They also talked about other things as well. So it's like a semantic fingerprinting of document, which comes automatically. Then you have here the entities, as I said, instances in the document, which I cannot see here, it's too small. And then they're highlighted as well in the document. So you click the specific part, you find the highlights in the document. And the same is also for events. So you want to find cases where specific causes of tuberculosis are mentioned in the document. And that's the same thing, they're highlighted. So you identify causality events automatically. So affect events also allows to explore if therapeutic measures have a positive or negative effect. So that's the search system. Apologies, I was struggling because I couldn't see it here, it's too small. But to finish up my talk, we're really continuing working on adding different entity types, more geographical locations. So the corpus that we have developed will be made publicly available for people who would like to build on that. And very much hope that will be the case. But we're expanding, we're adding more entities. So our historians, they were really keen on geographical locations, organizations, tools and materials. We're very much guided by what users want. And again, if you want to contribute to the corpus and add more entities, we'll be very happy to hear from you. We also have an infrastructure which allows people to basically look at the annotations which happen automatically. It's like a bit of crowdsourcing and make corrections. So if that's something of interest, we're very happy to hear views. And again, these type of gold standards are very useful for different types of the community, because people want to make enrichments in a completely different way. They can look at the corpus collection from different perspectives. The same BMJ, you can look at from clinical, from civilian part, from different diseases. So those event types and those entities, again, are indications rather than our own interests, but we'll be very happy to discuss with other people about expansions. Another things as well is about the discourse interpretation, which I mentioned briefly. We did it for Europe Med Central, but we very much like to add it into our corpus and our system. So as a conclusion, I'd like to say that again, some other things we are adding is we can add topic analysis and other things. But what I try to show is how we can enrich data, archives, medical archives, to support historians of medicine in this case, to do better search and to explore the collections in different ways. So of course we can think about linking different archives together and finding associations, which are very difficult to do if you're just doing keywords. And one of the things we're doing is by basically creating a big rich annotation database to allow other people to plug in tools for text miners, but basically to support a bigger search system. But the important part to remember is how, hopefully, is how you can search a collection in more semantically meaningful way, how you can capture terminological variation to, again, support search and entities and events. And I'll finish with saying thank you to several people. HRC for funding, of course, BMJ and Wellcome Library for making the archives, BMJ actually for making the archives available for us to text mine, and different people who did the annotations and the work. Thank you for your patience.
Thank you.